Apparently, the CDC said that 94% of the people that have died from COVID-19 had underlying health issues and 6% of the people did not. Why is this breaking news? This is something we already knew. We know this. The majority of people that have died from COVID have been the elderly and the people with compromised immune systems, aka underlying health issues. Why is this news? 3% of the people that have tested positive for COVID-19 have died in the United States. These are the numbers. Y'all are saying it's the worst virus of the century and it kills less than 1% of the population. Matter of fact, less than 1% of the population will even catch it. And it's the worst virus of the century? When was the last time you've seen a guinea pig turn into a hero?
Don Baker, we have that breaking news we're following out of Hinesville tonight.
Don Baker usually delivers the news.
You verify your name again?
But Monday morning, this television anchor in Savannah, Georgia made news, made history, as the first person in the United States to participate in a phase 3 clinical trial for a vaccine against COVID-19.
Big day. Certainly is. It's really exciting to me that I could be a part of saving lives eventually. I mean, instead of just being scared and praying.
After Don's injection, study leader Dr. Paul Bradley called Moderna the company that makes the vaccine.
Connor, I have amazing news. We dosed the first patient.
The National Institutes of Health is collaborating on the trial. Dr. Anthony Fauci marked the day on a call with the media.
I can tell you absolutely the first one was at 6:45 this morning in Savannah, Georgia. Indeed, we are participating today in the launching of a truly historic event in the history of vaccinology.
Don't y'all get tired of falling for this banana in the tailpipe? What did I tell you all? Didn't I tell you all they are going to start pushing this vaccine in our community? Who is the first person to get the phase 3 vaccine? I keep telling you all it's a setup. You all don't want to listen to me. I keep telling you all that it is a setup.
There are nearly 90 study sites across the country for this vaccine, and phase 3 trials are underway for 4 other vaccines, 3 of those in China and 1 in the United Kingdom.
Hi, how are you?
Scientists hope that results of Moderna's trial will be clear in a few months and a vaccine on the market by the end of this year or the beginning of next. But that's if the vaccine is proven safe and effective, which is not a given.
Let me explain how the Moderna vaccine trial works. This is the vaccine, and about 15,000 people nationwide will get injected with this during the clinical trial. Now, this looks similar to the vaccine, but actually it's a placebo. It doesn't do anything. It's just saline. And another 15,000 people will be injected with this. And then afterwards, doctors will compare who gets sick with COVID-19 and who doesn't.
How does the U.S. have more testing sites than the entire planet? I keep telling you all they use us for everything. If a vaccine started in America, would they go to China and ask people to participate in vaccine clinical trials? And I know you simpletons and cretins think this is bashing, but what you all don't understand is these people are on the payroll. They pay these people to do this stuff. They pay these people that look like us to influence us to do things like vote for candidates and like take vaccines. They always put the banana in the tailpipe, but we keep running around wondering why the check engine light is on.
Doctors are recruiting study subjects who live in communities where they're most likely to get COVID, so they can see if the vaccine truly works.
We want people who are going to be exposed out there in the community, living their lives, whether they're, say, a healthcare worker, where unfortunately we get exposed frequently, maybe they're working in a grocery store, but we want people that are unfortunately at risk.
That's why doctors are recruiting heavily among the African American and Latino communities where COVID rates are especially high. But it's a challenge because historically those communities have been abused in medical research.
Very suspicious. So maybe, you know, since I was at least bold enough to come forward right now, that might change that.
Coming forward to play a part in ending a pandemic that has brought the world to its knees.
Oh, one more thing. Be on the lookout for them wanting everybody to wear the exact same mask. It's too much individualism in this mask wearing thing. First, they told you all you can go home and put anything on your face. Now they're telling you they want everybody to wear a specific kind of mask because they want everybody looking and doing the same thing. You hear that? You hear that? The beast is coming.
I know my husband is not vaccinating people and putting a microchip in her arm because that technology doesn't even exist and he's never uttered the words out of his mouth. So
It's another grim warning. A prediction by a model previously cited by the White House of a coronavirus death toll of more than 317,000 by December. Researchers at the Institute for Health Metrics and Evaluation at the University of Washington said 67,000 lives could be saved, however, if 95% of Americans wore masks in public. Another doctor thinks even more people could avoid dying from the coronavirus.
We could save 90,000 American lives if 95% of people wore masks by the end of this year. I mean, that's just such a huge number of American lives that could be saved.
This week, amid the ongoing pandemic, crowds gathered on the White House South Lawn in support of the president and on the National Mall in support of equal rights. Some wearing masks, but little to no social distancing at these events.
The White House scene was a very dangerous scene. It is a super spreader kind of a case. You know that some of those people were unknowingly infected. They'll be infecting others. And 2 weeks from now, we're going to see the result.
Are we prisoners of the moment or are we just slow? Just look at the numbers. I don't care about what they're blasting on the news and with the media. Just look at the simple numbers. I don't care how much hooting and hollering you all do. 3% of the people that have tested positive for COVID-19 have died. I don't care how much hooting and hollering you all do. 3% of the people that have tested positive for COVID-19 have died. And I know that's tragic, and I know it's sad, and I know people lost loved ones, but does that 3% out of those that tested positive justify 330 million Americans getting a vaccine? Less than 1% of the population of the U.S. have tested positive for COVID-19. I don't understand why what the CDC said has everybody going crazy. It's almost like you all want to be afraid. It's almost like nobody wants to hear any good news. It's almost like people want it to be worse than what it actually is. I advise anyone to just look at the numbers. Less than 1% of the world has died from COVID-19. I just don't think that justifies 7.5 billion people getting vaccinated.
Yeah, the new bill would allow some people to be able to opt out. Capitol Bureau reporter Jackie DeFusco explains.
Well, currently, Virginia law actually gives the Commissioner of Health the authority to mandate immediate immunizations in response to a public health crisis. That is, of course, if a vaccine is available. When it comes to the coronavirus, officials say that could come as early as 2021.
If you presumably still are the Commissioner of Health when a vaccine is made available to the public, do you intend on mandating it?
Yes.
Commissioner of Health Dr. Norman Oliver says he strongly opposes a bill that would allow people with a religious opposition to opt out of an otherwise required COVID-19 vaccine.
I don't care how much hooting and hollering you all do or they all do, the numbers are the numbers.
Men lie, women lie, numbers don't.
Fuck the virus. The government full of shit. Ocala, Florida, this motherfucker. We hanging out. We got shit. We got this shit on us out here. We hanging out. And look, it's all for looking old, man. Ocala, Florida.
What up? Take that mask off. Fuck that virus. We fuck with Trump. Right. He a good president, but he talk too much shit. Fuck the virus, nigga. These hoes got AIDS. Y'all talking about the corona. Nah, they got AIDS.
Listen, I work tomorrow and Monday, so I can't be out here doing what they're doing. I'm just out here just to support my guys, but honestly, this is not good.
This is extremely interesting. You and I have talked about the viral load level from the very beginning as it pertains to how contagious the virus might be, whether you're symptomatic, asymptomatic. But what do you make of this as it pertains to positive tests? Because the important part here is positive tests equal what all of our public health officials are calling cases. And we're basing public policy not on deaths, not on hospitalizations, not on ventilator use or ICU beds, but on the cases, which are the positive tests.
Right. The rest of the world, when they use the word case, they're referring to someone who's actually sick. We know for a fact that China will not even test somebody who's asymptomatic, and if they do for some reason, it will not be considered a case in the absence of symptoms, and that's been their definition since at least early June. Europe also does not recommend, under most circumstances, testing people who are asymptomatic. If they do get someone who's asymptomatic, they will not consider it a positive test unless it's under 35 amplification cycles. In the U.S. right now, and what's remarkable is not that we didn't know this, what's remarkable is that the New York Times reported it, and they actually broke a new aspect of the story which we didn't know, which is just how common these sort of trivial or false positives are. Many labs in the U.S. are going up to 37 or even 40.
This is America. Donald Trump. Yeah. You like Trump? Of course. I'm Jewish. John Cena.
They just trying to push it to kill our people because the population's too high.
300 years ago, we were in slavery by your kind. They took our cooking, they took our culture, and they made it their own. The United States put out the COVID-19 to be able to actually kill and control population. We are the children of Israelites, so they can't kill us black folks. They're trying to.
I sometimes envy the zombies who believe that the only problem is an infection which causes a disease called COVID-19. They get up in the morning, check in the mirror to make sure that they haven't died in the night, munch their chocolate-flavoured bran flakes, choose a mask that goes best with their outfit for the day, and venture out into the world a little nervous but confident that their government is doing its best to protect them in these tricky times. As they go about their business, they disinfect their hands at every possible opportunity, carefully obey the social distancing rules, and wait impatiently for the vaccine.
Wait for it. Free blast. Get money. Go.